Hi, I'm Krista Simpson Anderson, Army Emergency Relief's Military Spouse Ambassador. Every week, I get to share some information and some resources to fill your resource toolbox. I want you to thrive in this military life. It may not be something that you can use today, but remember, it may be something that a friend or a colleague can benefit from as well. So, as many of you know, we just closed out September, which was Suicide Prevention Month, where we provided some great resources and tips from DoD Suicide Prevention Office, the Connect to Protect campaign. And of course, Army's motto is people first. And so this Sunday is World Mental Health Day. So with that theme, I get to share with you my dear friend, Corie Weathers. Corie is a clinician, a military spouse, a mom of boys, an advocate for military families, and an advocate for our mental health.
Hello.
Hi, Corie.
It's so good to see you, my friend. One of my favorite people.
I know. That's what I love about this. I swear every week I actually tried to stop saying I'm so excited to have a very special, because then finally the other day I was like, every guest I have is very special, right?
We're all excited. We're all excited together.
Yeah. So I love having these conversations with you, and we could definitely do this for hours, of course, but don't worry, viewers, we won't keep you for hours. We'll try to get to the point. You have LifeGiver.org, which is such a great resource for me when I get to provide spouses and military families some tips and resources to fill their toolbox. Tell us a little bit about LifeGiver, the LifeGiver Directory, and what motivated you to create this.
So first of all, thank you guys so much for inviting me. It's always an important topic to talk about mental health, to talk about reducing the stigma of mental health. What does it mean to get help? It's going to just always be an important topic and an important thing for all of us to understand how to navigate all of that. I am a military spouse. I'm also a licensed professional counselor. And so I've spent the last 20 years working with military families, working with trauma-related stuff, working with first responders as well, because a lot of our first responders are veterans. And so this has always been a very important topic to me. And so LifeGiver is the name came out of, I wanted to breathe life into people's marriages, into their circumstances. As a clinician, it's been my greatest, purpose to step into some of the darkest places of people's lives and inspire hope somehow. And so LifeGiver was born out of this desire to find these different ways to breathe life. And so when it comes to how do we access mental health care? How do we access hope? LifeGiver, it started off as a place of just resources, and the website definitely has lots of resources. It has a podcast. It has books that are often recommended in counseling sessions, blogs. There's a whole lot there. But what you brought up was the LifeGiver Directory. And this was, honestly, it came out of my frustration as I worked with organizations that serve military families and trying to provide programming. They knew kind of the end of their programming, a lot of our families need more referrals. They need extra help, or they need that attention to detail to what's going on in their life. And so they really struggled, like all of us struggle, with how do we find competent professionals, competent clinicians that understand our life, understand our circumstances. And so they would ask me, help us find referrals, help us find clinicians that really get it. And I found myself frustrated trying to find clinicians who understood our lifestyle. And it wasn't that they don't exist. It's just that we are taught as clinicians to not put that on our websites, or to be that personal, to say I'm a military spouse, or I've been through 3 deployments, or whatever. So the LifeGiver Directory is a directory of clinicians who are either military spouses, veterans, civilians who have either a personal experience in their life with the military lifestyle, or who have been educated and have that competency to understand your world. And so it's an easier place for you to search for clinicians. And we have over 200 globally and counting that are still building and coming onto the directory. So it's a place for all of you guys to search for clinicians easier than maybe some of the other places that you're trying to search.
And I would say, and I know that you're always welcoming more clinicians and coaches and such to submit their information for the directory, because the bigger it gets, the greater of a resource it is for us as family members. And as you know, I live in Virginia. I mean, we live like 10 miles from the White House, and I was trying to find a clinician for our boys who are 9 and 11, and through the system. So we don't have to get too deep into it, but in-network, out-of-network providers for Tricare. You may not be able to see those out-of-network, but they still take Tricare. And so there was a response back that said, there is no clinician available for your family in the Northern Virginia area.
So many families have gone through that. And so just really quickly, we are so...
But there is clinicians available, I would say, and then that are covered under Tricare. And so it just takes a little bit more digging, but please,
And so let's talk about that for just a second, right? And so we are so lucky and so thankful to have the benefits that we have through Tricare, which, if you don't know, you've got Humana, that's mostly the East, I think, and then you've got HealthNet, that is your West. And so they cover your mental health benefits. And so let's talk about that really quick. So in-network just means that I, as a provider, contract at a certain price to work with military families. But a lot of providers, not just mental health providers, but your dentists and other doctors, have really struggled with those contracts. And so some of them have chosen to go out of network, which just means they can kind of navigate their own prices, and it's their choice. It's their business, right? And so your benefits, first of all, if you need to get help, first of all, let me tell you that you do not need a referral to get mental health care unless you are getting a psychological assessment, which is different from just counseling. Okay.
Right.
A psychological assessment is usually if you go to a counselor and they're needing to dig a little bit deeper, and we say, do we need to see if there's an ADHD issue or some of those other issues that we actually need assessments and tests to measure it, right? To just get counseling, you do not need a referral, whether you are prime or, I guess, select is not standard, select. So you do not need a referral. Now, if you are the active duty service member, you do need a referral, and the military is going to want you to go through their system. So the Tricare directories are a little bit sparse. They're a little bit, they're struggling a little bit because there's a lot of movement happening. There's a lot of people going in network, out of network, and they're mostly going to show your in-network contracted providers. But the LifeGiver Directory basically shows any clinician that wants to work with service families. And then you guys get to do the talking to figure out, do you want to go in network? Do you want to go out of network? What does that mean? And most of the time, I am an out of network provider, as an example. Just because I'm out of network does not mean you don't get to use your benefits. So as an out of network provider, I actually still file for Tricare, and Tricare still pays me, and you pay a copay if you're standard, right? So just because somebody's out of network, do not let that scare you from getting help. So you can navigate that. Sometimes the provider will file that claim for you, like I do. Sometimes you'll pay that provider and you submit for reimbursement. So there are definitely some ways ahead, but don't let that out of network scare you.
Awesome. I know we didn't necessarily talk about this earlier, but I want to talk about marriages, and I'll use mine as an example on some other options. I've seen a lot of spouses talk about, how do I encourage my service member to maybe seek counseling, marriage counseling, whatever that looks like. And there are certain times, I think, in their career where things change. And for us, it was the transition from a tactical unit, to a non-tactical unit, and just kind of navigating those waters. And so I wanted to learn a little bit more about kind of where his head was at, and probably vice versa. And we were able to use coaching instead of actual counseling course, it was through a counselor. But, for me, talking to my husband about that, it was a little bit easier for him to get on board. I think in those terms, and that's not necessarily covered by Tricare, but it was definitely worth it to kind of dive into that coaching session, because you do our top 5 strengths. And I was able to say, lower your expectations of me. And I understand why your expectations are high, because these are your strengths. And so, I laugh when I talk about how Gus, I tell people that Gus now takes my adaptability as a strength and not like just flightiness. Yes. Why can't she finish a task?
It makes me so happy to hear that. So what Krista is talking about is coaching, and coaching is becoming, it's really, people are starting to do coaching a whole lot more than ever. I think partly there's several reasons. One, you can call coaching non-medical care, right? So Military One Source, for example, is non-medical, and it's kind of a version of coaching. You get 12 sessions before you can renew those sessions. It's like coaching. And a lot of us clinicians are those Military One Source clinicians that provide that non-medical care. That's basically like coaching, right? And so LifeGiver,
they also have career coaching through Military One Source too, which could actually be beneficial, all the way around.
When you are looking for marriage counseling isn't necessarily a medical issue. So that's why it's hard to go through Tricare to get marriage counseling, or why it says that they don't cover marriage counseling, because it's not medical. It's kind of like a life issue, right? And so Military One Source definitely covers marriage work or coaching or non-medical sessions. Now, there are ways, we may not have time to get through it today, but there are ways to go and use your Tricare benefits to get help for the two of you. Talk to your counselor about that. But what Krista is talking about is coaching, which LifeGiver we also do coaching. I personally love it even more than counseling, because it's on a limited number of sessions, and our service members, I think all of us really, but she's talking about Gus specifically, right? And I think they tend to like these like limited number of sessions that are solution focused, that help us kind of identify what do we want to work on, where are we going to end up by the end of those limited number of sessions, 5 sessions. We do strengths, a strengths approach. So we look at what you're doing right. We look at how you can see your spouse from a new perspective, so that, in marriage, after a while, we're kind of looking at them like, how can we change you? And how can I make you do things that I do it my way? Whereas a strengths-based approach is really seeing how your spouse is bringing the best version of themselves to the table, and you are too. And so I like superheroes. So we kind of talk about like, how do we actually bring the best version of ourselves to the table and become that Avengers team? And I honestly think both military spouses and service members love that approach, because counseling can, people a lot of times are afraid of counseling. Like, we're going to go and we're going to rip each other apart and talk about all the negative stuff. Whereas where I don't think that's what counseling needs to be. And it's not that all the time. My favorite sessions are when we celebrate what you're doing right. But coaching, having it be that like limited number of sessions, helps you kind of stay on that surface and really tweak a few things and get you guys on a good track.
Yeah, I mean, we came at it from a growth kind of mindset and understanding each other, and I use that all the time. He'll ask me something, what if we changed plans, or what if we did this instead? I'm like, I'm adaptable. You know that.
She's using adaptability as one of the strengths to use the Gallup Strength Finder. It's one of the themes, and it's like the whatever people. And some people get really frustrated with whatever people, because seems like they're never making a decision. But what Krista is saying is that it's her gift to her marriage, is to kind of adapt and let him decide. And he's going to have that stronger opinion than her. And so what used to cause them a lot of conflict, because he just wanted her to make a decision, now he sees as a gift that she's gifting him with the ability to lead out on that. And that just transforms a marriage when you can transform that moment. So I love it. And I'm so thankful, and I'm so glad that you guys actually are starting to see that in each other. My husband and I have been working on ours for like 10 years. And I think I can honestly say it saved our marriage for sure. Because I do not have adaptability as a military spouse. It is my biggest weakness. And now that my husband knows that, he's like, all right, I need to give you 4 days for every new set of orders. He gives me 4 days. We don't even talk about it for 4 days because I just need time. Nothing good's going to come out of my mouth for 4 days.
Time to absorb it, process
So,
it. Yeah.
there are great tools. There are great resources for anyone that's listening, regardless of where you are in your marriage, whether it's pet peeves, whether it's bigger issues that are going on. Please know that it is okay to reach out and find the help that you need. There's so many creative ways to access help now. There's really no reason to not reach out and use the benefits that you have, use the resources that the DoD gives you as well. We have a lot of opportunities that a lot of people out there don't have.
Absolutely. We talked about the stigma of mental health, and, quickly, I'll tell you, I remember when my therapist back at Joint Base Lewis McChord moved into a secure building. And so I had to go into the something or other shop to get an ID, to badge into the building to see him. And the young soldier said to me, so how long are you going to be needing this? And I said, excuse me? Well, how long are you going to be going to these appointments? And I said, do you go to the gym? He said, yeah. I said, how long are you going to be doing that for?
Yeah.
He said, and he was like this big fit guy, and he's like, forever. And I was like, okay. I'm like, that's my limit, is forever. I was like, you like to keep your body fit. I want to make sure I keep my mind fit. And so I think if we look at that, and of course you may not see, of course, a clinician every week for the rest of your life, but I think it's important for people to really kind of connect, right? You go to the gym, it's very similar. You want to be healthy. You eat right, you exercise, and you make sure that your brain is healthy too.
There's so many ways that you can see getting mental health and fit it more into your lifestyle. For example, we move a lot, and a lot more than the average family does. And so for me, I kind of just decided every other assignment, I'm going to go see somebody. There are other people that really feel like they're doing generally well, and they plan strategically a counseling session for their anniversary every year as a way to check up on how they're doing, to tweak a few things as a gift to each other. So there's some families that do that. There's some people that go quarterly. And it's also okay to do it seasonally. There could be seasons. There are definite seasons in our lives that are harder than others. And so it's also okay to go for a season, take a break, and kind of wait for that next season. It doesn't always have to be when things are really hard. It can be when you really want to grow, consider coaching, when you want to grow together. You feel like you've kind of grown apart. And so how do we kind of work on something together that's outside of ourselves? The Strength Finder is a good example. Let's work on something together that's neutral, that kind of helps us grow together and actually grow towards each other, because we just need that right now in our life. So there's books that you can read, podcasts that you can listen to. There's a lot of things that you can do that kind of change your perspective on how to actually include it into your overall wellness instead of being so afraid of it. Krista, I know we're about out of time, but I had somebody reach out to me this past week that wanted to get care for their teenager. And they were so concerned about whether or not some diagnosis was going to affect their ability to go into the service later. And this is just a reminder that getting help and taking care of yourself, first of all, is more important than anything else you could do in your life. So first of all, it's okay to make that a priority. Second of all, most of the time, a diagnosis of worst case scenario, a diagnosis of depression or anxiety that happened during a certain season of your life isn't going to mess up the rest of your life, right? There are things like asthma diagnosis and something like that that's not even mental health related that you can check into. But most of us as clinicians are going to give the mildest thing that we could possibly give if Tricare makes us give a diagnosis. And I'll be honest, most of the time I'm going to give the mildest one I can give is adjustment disorder, unspecified. That's the mildest thing I can give when you use your Tricare benefits. And honestly, we are constantly adjusting. It's truthful. It's honest. It's not going to mess up anybody's career. So if your child needs help, if you need help, do not be afraid to engage in that conversation with your clinician. Don't be afraid to do that research. And even if there is something for some reason that maybe could be in someone's file, and that is very rare, please hear that. know that your health and your mental well-being right now is more important than anything else that could happen in your future. And it actually dictates what you will do in your future, the character that you'll have, and your coping ability in the future, regardless of what career you choose. So take care of yourself now, take care of your kids if they're asking for help, or if you know that they need help. That's a whole other subject we could talk about for a long time, but please don't fear that stigma. Very important for me to say today.
I think because the alternative is far worse, right? You know, when you look at that, if you don't reach out. I know we had 1,000 things that we wanted to talk about, so I hope you'll come on again. But I do want to mention real quick the survey, or a survey that you put out that I think is important. And you've got such a great response to the survey and the questions that are asked, to really take the pulse of our military community, our military spouses, because I think a lot of times we're so focused on our service members and their mental health that sometimes we forget about the families and, you know, the kids and the impact that has, to make sure that we, that we keep them connected with the resources that are needed too. And so, can you tell me a little bit about the survey, and then, when people can actually take that survey? I believe it's anonymous, so you don't have to worry about that.
Yeah, at LifeGiver, we actually like to do market level research just to kind of understand the culture, understand what you guys are needing and what you're dealing with. And so the survey that Krista is talking about is one that's called the Anonymous Military Spouse survey, measuring like what kind of, when you go see a counselor, what good experiences have you had, what negative experiences, what do you wish you could have said to counselors that they so that they understood your life better. So we had in that survey over 800 spouses that took that survey, gave us amazing feedback. It's still open for you to access. It just helps us educate and train up clinicians in the future. It helps us reduce the stigma if you still are struggling with that. And there are other surveys. We're about to put one out the next week where we're talking about like, where are you going to get help as far as when you do think that you need it? Are you going and using your benefits? Are you instead going to podcasts? Are you fatigued because of all the Zoom calls? It just helps us understand better what families are going through and where you're going or where you want to go in order to find that help, to identify those gaps better. So I would appreciate it if you've not taken the survey, take it. It gives us wonderful feedback where we can go and advocate for you to the DoD, to Tricare, even to educate people on the needs of the community.
And then you've also done a lot of work with universities where you're able to help them create a curriculum for mental health professionals that allow them to kind of get to that point where they are, I love what you say, culturally competent. So I don't have to sit with a clinician and take maybe 3 sessions to explain what it's like to go through a deployment or to move, often, or whatever that looks like. So.
Yeah. No, I know we're almost out of time, but we partnered with Baylor University, and they created a CEU course for clinicians to teach them about military and first responder families. And I'm so excited to tell you that we made sure to include a whole module on military spouses and the things that we rarely say out loud, the things that we struggle with, and also the dynamics of the military marriage, the things that we felt like clinicians really needed to understand, that again, marriages typically don't say out loud, and the things that they struggle with. So we are working really, really hard to make sure that we can prepare as many clinicians as possible to welcome you guys into those offices or over telehealth. So there are people that are working hard for you guys for sure.
Awesome. Thank you so much. Okay. Well, we're definitely going to have you on again because there's so much more to talk about. So we'll plan that. And thank you so, so very much for all of this. And we've got a bunch of stuff in the chat, and the Google Doc, the Google form there is the survey. When you click on that, you'll be able to fill out that survey. So thank you, Corie. I appreciate you.
Thank you, friend. Good to see you.
You too. Thank you so much for joining us. This was such a gift for me, and I hope that it has blessed you as well to have Corie provide some tips and resources. And check out her website, because there's so much more, and she has a podcast that's really, really incredible. And next week we get to talk about legacy giving, and so don't forget to tune in, because you'll hear a lot more about that. Thanks so much. Take care.